Hello and welcome to today's Wired briefing, utilising technology to tackle the healthcare backlog. I'm Greg Williams, the Deputy Global Editorial Director of Wired. And in today's briefing, we're going to explore how the NHS can manage the elective care backlog while also transitioning to new models of care under integrated care systems. Improving efficiency to give back time to care remains one of the highest priorities for health services. Today, we're going to discuss what practical things healthcare organisations are doing to manage down the more than 5 million waiting list for elective surgery and share how tech organisations can be partners in the modernisation agenda. And with that, I'm delighted to welcome Jacob West, who leads Microsoft's UK Health and Life Sciences business. Jacob is a senior leader with board level and international experience in government, healthcare and not-for-profit sectors, and has advised 2 UK prime ministers on health policy. Jacob has a track record of driving innovation and change in the NHS on both a national and local level, and most recently, he served as Executive Director of Healthcare Innovation at the British Heart Foundation. Jacob, welcome. Great to have you with us here today.
Great to be here, Greg.
So just as a starting point for the conversation, it would be great to get your sense of the problem that we're trying to solve here, an idea of the landscape and just the scale of the challenge that we face.
Thanks, Greg, of course, yeah. So I think there's a triple whammy here, really. So we've got record levels of people waiting for planned care. We've got continuing pressures on acute care, and we've got, the NHS staff facing burnout, really, I think it's fair to say. So on the first of those, I think it's nearly 6 million people now waiting for elective care. That's a record ever level. It's rising by about 100,000 people a month. So this is a huge challenge, as over 300,000 people waiting for diagnostic care. On top of that, we're not out of the woods in terms of COVID itself, and that is putting real pressures, particularly as we face into winter on acute care. So I think it's more than 1 in 4 people, the latest numbers suggest, waiting longer than 4 hours in A&E. Again, some of the worst numbers we've ever seen on that front as well. And then finally, you've got this, a workforce who've made Herculean efforts really during the course of the last 18 months or so in combating COVID, but they're really facing burnout. You've got, nearly 50% of people saying that they face work-related stress. Large numbers of people, that majority in some surveys saying they'd like to leave the NHS or consider leaving the NHS. And so if you put that all together, that's really a very difficult challenge. So what can we do? Well, technology certainly isn't a panacea here, but I think there is the opportunity to think differently about how we provide care. And it was great to see the Chancellor committing very significant sums for technology to address the waiting list backlog. So I'd like to see how that plays out. And also we have some historic form here. So in the early 2000s, waiting lists were very high, but we did manage to get them back to manageable numbers. So although it's a huge challenge, I'm somewhat optimistic.
So you've laid out the landscape there. It does sound sort of like fairly terrifying, 100,000 extra people per month, nearly 6 million people waiting for care, ongoing acute pressures on the NHS. It would be great to understand from your perspective now what the opportunities for technology are to address this really sort of significant backlog of care within the NHS.
Well, one of the reasons I'm somewhat optimistic is because of this transformation we saw digital transformation we saw during the course of COVID in healthcare particularly. I think you probably saw it in many industries, but I think we can say in healthcare it particularly came to the fore. I guess that's most obviously expressed in virtual consultations, virtual visits of that kind, but actually it manifested in many other ways. Having said that, technology is not a panacea. Technology is not going to address this backlog in its entirety. And I think it's really important to caveat that. Care is delivered by people, and we know that there aren't enough people working in the NHS, that they're under significant pressure, and that they are, I would say, close to burnout in many instances.
Yeah.
But if you take a step back,
Go ahead.
I think there's opportunities at every stage of the patient pathway. So if you think about primary care, things like digital triage, if you think about outpatient care, moving to digital first appointments, when you get into the hospital, thinking about very differently about patient flow and capacity management, and then after hospital, remote monitoring and the hospital at home model. All of these things have been tested in limited environments. Some of them are starting to get to scale. If you put that all together, that starts to look like some of the answer to the challenge that we face.
Now, I read a study, I think last year, that showed that GPs spend more time on their computers than working with patients. So I'd love to get your sense of, how we can look at it from a clinician's perspective. How do clinicians experience technology on the front line of the healthcare industry, and how can we improve that for GPs?
Well, let's start with GPs, and that's, it's the point of care that most of us engage with. It makes up the majority by volume of care in the NHS. On average, a GP might see up to 40 patients a day in some form. Sometimes fewer, sometimes more. They may have on average 7 minutes with that patient. You want to maximize the time to care, the time that you're focused on the patient. And so you're faced with a choice. You either contemporaneously take notes as you're going through that encounter, or you do it after the event or at the end of the day. Often that's what GPs do, and that has a massive impact on either way you go. That has a massive impact on either the patient experience or the caregiver's experience. So one of the opportunities I'm most excited about is when you combine sensor technology and artificial intelligence to really think differently about the patient-clinician encounter. And Nuance, a company that Microsoft is in the process of acquiring, is a world leader in that. So that I think is an exciting way in which technology can actually take away technology. The doctor doesn't need to write in the notes instead of looking at the patient. Actually, this passive technology can take all of that rich information and turn it into a structured note and save time and increase and improve patient experience. And then if you think about the hospital setting, if you're a doctor or a nurse, logging onto a device, you're often faced with multiple systems. You have to constantly context switch, from the EPR to the specialty system to the back office system. How can we manage down those numbers of context changes? I think that's a really important challenge. And again, there's multiple ways in which technology can improve the experience for the healthcare professional in that context as well.
So let's move on maybe from the primary care physician and look more broadly in terms of the impact or the types of technologies, I could say, that we can put in place in the treatment, diagnosis, surgical methods in order to see more patients quickly and safely. But what kind of examples are you seeing within the healthcare system that really could make a difference on bringing down this list of people waiting for surgery?
So some of it is actually very simple technology. So let's start with managing appointments. So there are, I think, around 10 million missed appointments in England every year. I think that was the last number I recall seeing pre-COVID. Certainly, numbers may have changed since then. If you add that up, that's over £1 billion wasted a year. Roughly, that's about 1 million cataract operations. That's about a quarter of a million of hip transplants wasted. So that's a big chunk of change. So how can we get better at managing those missed appointments? So very simple missed appointment system supported by text technology, not the newest technology, can really drive down those rates. So there's an example I know of at Colchester Hospital where they essentially use a sort of digital workforce platform where you get an automatic reminder of your appointment and periodically nudged. If you aren't able to make the appointment, then it could be automatically reallocated to another patient, delivering huge savings and huge productivity gains over time. Scale that up, and that looks really quite impressive for the NHS as a whole, I'd say. So that's one opportunity in outpatient care. I think another one I'd highlight in the hospital setting is what they've implemented in places like Salford and Essex. So it's really getting a handle in real time of your supply and demand in the hospital. So it's what many other industries have done for many years. And so sometimes it gets called a command center, a digital command center. And so in Salford, I know they're looking to take out about 15 to 20% of capacity through implementing this. You have real-time information about your patients, their clinical indicators, their admission history. You combine that with real-time data about bed management and also about discharge, who's going out of the hospital. Put it together, and I think you can free up quite significant capacity. Salford, I know, are looking at about 150 beds a day if they implement that fully. And then also in the hospital setting, quite different, I suppose, but in Milton Keynes, for instance, they've introduced robotic surgery to augment the human surgeon, but really, really impressive what they're doing there. Far faster recovery times for patients because the surgery is less invasive, less time in hospital, and reduced risk of infection. So I think at every stage of the patient pathway, there are real opportunities for technology, often just to augment, sometimes to substitute, in some instances, even to replace human delivered care.
And we read so much about, the NHS integrating its care systems. What kind of impact do you think technology can have within that particular process?
Well, that's right. So the NHS has set out the plan to move towards these new operating units called integrated care systems, which bring together primary care, secondary care, mental health care, and reach into social care and local government too. And they will become legal institutions in 2022. We see, I think, three main opportunities for technology to support these new models of care delivery. And actually, these systems, they're not just peculiar to the NHS. If you look around the world, I would say most healthcare systems are testing or implementing models of this kind. In the US, for instance, they tend to get called accountable care organizations. In other places, different terminology, but actually very similar approaches, I would say, all up. And so the first of those opportunities is around what you might call fixing the plumbing, up-leveling the technology infrastructure across the system, because there's no point moving at the pace of the fastest organization if another hospital down the road that you want to work with hasn't even moved to digital systems. And we know that 1 in 5 hospitals still more or less are largely paper-based. So that's a huge opportunity. How do you fix the infrastructure to address cyber threats, storage challenges, identity challenges, so on, and in a way that helps deliver seamless care for the patient, but also easy care, if you like, for the caregiver. I think the second opportunity area is around multi-team collaboration. And we're not speaking on Teams today, although we could be, but the NHS uses Teams, has a license across over 1.5 million people. It was so exciting to see the story a couple of weeks ago from the NHS that the application of Teams, the implementation of Teams, had released about 3 million staff hours, time back to care effectively through the efficiency of remote meetings and the avoidance of unnecessary in-person meetings. So if you start to think about what's the next developmental stage of that, using remote technology won't work for everything every time, but to encourage interdisciplinary team collaboration. How do you get multidisciplinary teams to work together across organizations, breaking down professional silos? This kind of technology that we're talking on today absolutely has a role to play there. And then I think the third area for integrated care systems is thinking about how you realize the value of data. How can systems become intelligent health systems that are provide more anticipatory care, predict the risk of patients becoming sick, and so on? And there's great examples of that already. What Cheshire and Merseyside are doing with the Cypher tool, which is a population health management tool. What we with others have been working in Dorset to get better real-time data about patients, particularly before they become sick or become sicker. That's the key, really, anticipatory preventive care. And then also how you think about using that data with appropriate conditions around it to drive research. and to feed back ultimately into better quality of care. So those would be, for me, the three big opportunity areas when it comes to integrated care systems.
And I think that point you made about the anticipatory care is a really interesting one, because obviously we've seen huge changes during the pandemic, with people becoming really used to testing at home. I wonder if you think that there's an opportunity for more of this within the healthcare system, people self-testing, self-reporting from home, and perhaps that could create efficiencies in areas such as diagnostics.
I think that's a huge opportunity area. You're absolutely right. And roll back 18 months. The vast majority of us wouldn't have been used really to testing for anything at home. Now we're all doing lateral flow tests. Very frequently. Some of us every day. So we have both the sort of, I think, a cultural acceptance, maybe, if not a delight in home diagnostics, but also some of the physical and digital infrastructure that means that we can scale up that for other condition areas. As the pressure of the pandemic starts to relieve, how do we think about utilizing some of that platform, both the public's willingness, but also the infrastructure that's been put in place to scale up diagnostics? And there's all sorts of interesting companies moving into that space, like Healthy EO, who do urea analysis via your smartphone camera, and then actually there's opportunities to think about how you layer AI on top of those diagnostic tools to be able to get more accurate and quicker readings. Companies like Sensign have been using that technology, for instance, to get more accurate results from lateral flow tests. So there's huge opportunity areas, I'd say.
Yeah, you just mentioned AI there, Jacob, and obviously AI is seen as kind of like a panacea. Like we can roll it into everything, and it's going to solve all of our problems. How do you think that it can be used very specifically to tackle the elective surgery backlog?
Yeah, I don't think it's going to solve all our problems. I do sometimes think, and maybe that's counterintuitive for someone who works in a technology company. So I think there's huge promise, but let's just be a little sober about it. So I think sometimes we underestimate the opportunity of good data analytics, and maybe overestimate the potential of AI, at least in the nearer term. But look, there are opportunity areas, and companies like Ultromics for cardiology, for Chiral Medical for breast cancer screening, and others are showing just exactly how this technology can be applied in the near term. Exactly how that flows through into managing down waiting lists, I've yet to see very good evidence on that, but I'd be delighted to see it. But certainly, we're getting quite compelling evidence that, particularly in imaging, this is the sort of most prevalent, the modal use case, I would say, of AI in healthcare, that you can get more accurate diagnoses and that you can improve workflow. Another example is InnerEye, that project that Microsoft Research have been developing with colleagues at Addenbrooke's in Cambridge. We're seeing 13-fold improvements in the time it takes to contour scan in preparation for radiotherapy for certain cancers. So there are definitely efficiency opportunities. Whether it's going to be the solution, well, it won't be the single solution to the 6 million people on a waiting list, I think it's fair to say.
So at the beginning of our conversation, you outlined, the scale of the challenge. 6 million people, as you say, waiting for elective surgery. Additional numbers joining every month. Obviously, the NHS is just a vast organisation. Clearly, if we're going to sort of roll out technology, we need to be able to apply it at scale. So I'd love to get your thoughts on what the biggest barrier is to this. How can we kind of remove the barriers to applying tech at scale in order to sort of tackle some of the challenges that you've outlined?
Yeah, I mean, it's multifaceted, because it isn't simply a technology challenge, right? It's a system challenge too, because the most important technology changes are ones that ultimately change processes and involve behavioral change, aren't just substituting for them. That's where I think you're going to see the biggest productivity benefits. But implicit in that is that you also need to bring about behavioral change, organizational change, professional change. So that there are a set of barriers around and you could apply that to any kind of process change, any kind of innovation in a system, let alone healthcare. There are technology challenges. So, interoperability is not an insuperable challenge, but it just makes it harder to implement technology that integrates with systems, and there are multiple legacy systems in any NHS organization. And when you have to do that, that means it's easier to give up, or or harder to implement the system quickly, and therefore that has a knock-on impact in terms of the cultural acceptance of a new change. It's very easy, and I've seen it myself, for organizations to give up on, or to to lose the clinical population in particular when trying to implement a technology change because it's taken too long or it's not been intuitive. So I think you have both a set of organizational, cultural, and technology challenges, but we can do it, and there's great examples. And somewhere in the healthcare system, to paraphrase that quote, the right technology is being used, we just need to distribute it evenly.
And just a couple more questions, Jacob. I'm interested in getting your views on, we hear so much talk in the healthcare industry about aligning technology in a kind of a patient-centric way. How do you think we can best improve the experience for patients, maybe who are undergoing treatment?
Yes, well, a great place to start, and perhaps this sounds too simplistic, is what is the problem we're trying to solve? So let's start with, normally it's the quadruple aim, right? Better health, better care, better experience, lower cost. That's what we talk about when we talk about health system transformation. And let's start with better outcomes and better experience for the patient, and work backwards from there. And very often, even though everyone sort of intuitively knows it, that you don't want to go looking for a nail just because you've got a hammer. We do tend to approach challenges in that way. So I think that's the fundamental principle. It's designs and systems thinking, so that you start with the outcome you want to achieve and work backwards from there. And then as part of that, you think about what are the pain points. What is it that is really impeding a more positive experience for patients in you talked about an in-hospital setting. And sometimes it's very simple things, and sometimes it won't be technology that solves that. And I think having the humility to recognize where technology can be an enabler, can help address those pain points, and where actually it might get in the way is really important part of that design thinking.
So final question, because we're up against time now, but just let's look forward. And I know it's hard to sort of future cast much more than 3 to 5 years ahead, but maybe think about that time frame. How do you think technology is going to help the NHS and other health systems across the world improve productivity in order to sort of really tackle this challenge that we face?
Well, hopefully I've given you some examples. I mean, and some of those are you could say they are point solutions, but actually, the real opportunity is when you start putting them together and into a health system that's got a foundational data layer that is able to make best use of technology in a very integrated fashion. And I call that vision of the future, and I don't know how far off it is, but we have some inkling of it, intelligent health systems. So, and intelligent health systems work on multiple levels, but they essentially, at the core, they have the technology that can facilitate the ingestion, the curation, and the use of data from multiple sources. This explosion of data, not just about the patient, but also from many other sources, that if you capitalize on it, really unleashes this amazing potential to think quite differently about the change we can see in healthcare. And that, I think, is when artificial intelligence and machine learning really come into their own, because you have these clean data sets which offer the potential to really personalize care, to really transform the patient experience, to really improve efficiency. We're not there yet, but I think it's in the future, and I'm looking forward to helping move us somewhat in that direction.
Well, that's a great place to end the conversation. Intelligent health systems, we look forward to seeing those coming in the coming years. Jacob, thank you so much for your time today. Really enjoyed the conversation. Really great to get your insights on this incredibly important topic. And if you enjoyed the session, please do check out the other episodes of Wired Briefings at wired.co.uk. Thank you all for joining us today. Stay well, and we will see you soon.